Hello everybody, it's Dr. Jen here with Freedom Family Chiropractic. So I wanted to jump on quickly and go through a little bit of like a pop-up webinar. So I titled this one, Pregnancy or Chiropractic and Pregnancy are like go together like peanut butter and jelly, because truly it does. Like there are so many women who I talk to who are either in the office or sought out chiropractic care during their pregnancy, and they had amazing benefits through it all. So some of the benefits I have seen personally in the office are that decrease in like sciatic pain. So we know that a lot of women through pregnancy, we have that relaxing going and the pelvis changing and everything so that baby can grow and develop in that area. But in general, when we have like that pelvis growing and developing, it'll cause more tension on the pelvis, and that's where we see like that sciatic pain. But then I have seen other ladies who have said that their headaches have gone away, they're sleeping better, it's helped with allergies, and the big one I've seen is it's helped with like morning sickness with some of my patients. So those are some of the benefits I've seen patients in the office report back saying through chiropractic care, this is what it's helped with. But I want to go through a couple different things of what causes tension on the pelvis or on the nervous system throughout pregnancy, and how we can make sure that these pregnant moms are living on that brake pedal, that parasympathetic side of the nervous system, so that they can easily grow and develop this baby that's in their uterus. So I am certified in Webster's technique. So Webster's technique is a specific chiropractic technique that looks at releasing tension on the pelvis, uterus for pregnant ladies. So that is a specific type of certification, a different technique that people can choose to become certified in. So that is a big one that I'm certified in, and some of the things that I talk through today is what we learned through that certification. So there are three main things that cause dystocia, and dystocia is that difficult birth. So what we want to do is make sure that mom is ready, baby is ready for birth, so that things come with better ease for them. I'm not saying that there will be no pain or anything, but just so that their bodies are more prepared and ready to have this baby, and there is more ease in general on their bodies, both ease on the baby and mom. So there's three main things that cause the dystocia, and we're looking at the passage, the passenger, and then the power. So those are the three things. I'm going to dive deeper into both or all three of them. So first off, the passage. So I keep looking down. I have a couple notes here, and then I have my pelvis here. So when we look in general at the passage, so the passage is the pelvis that we're looking at, and baby needs to be able to get through, to obviously go through the birth canal and exit mother. There we go. So we want to make sure that there's a balance within the pelvis. A lot of times what I look at and what I see on pregnant moms is that their sacrum, which is that middle bone here, is their keystone. It's the backside. So this area becomes misaligned. When that becomes misaligned, then it puts tension on the uterus, mainly through the round ligament. So those are the big things that I look at, is looking at how is the pelvis aligned in general, what is the sacrum looking like, making sure that your psoas or your psoas muscle is balanced along with your piriformis. Piriformis is on the back area. When we have tight piriformis, that's when we see that sciatic pain too. But making sure that those muscles, the soft tissue, the round ligament, all of these things are balanced so that it puts less tension on baby and has mom more at ease. So looking at that passage, and then we're looking at the passenger in general. So the passenger is the baby, right? So we want to make sure that baby is in the uterus, growing and developing all properly, and in general we want to make sure that baby can get in the correct position so that it has an easier delivery for mom, or that in general so baby can come out more at ease. So through the Webster's technique, that allows baby to have a little bit more room and get into the proper position that baby needs to be in. And then lastly is looking at the power in general. So looking at power is more looking at the uterus, like the force that needs to come on or happening so that baby can leave the uterus, leave mom, and that there's proper dilation and that the muscles are all working properly so that everything flows, baby's able to leave and have a proper birth. So those are the three main things that we want to make sure are working properly so that there isn't dystocia. And through all of those things, what that happens is it allows the nervous system to function correctly. It puts more ease or allows more ease on mom throughout pregnancy. So if you watched some of the other videos in the past, you've probably heard me talking about that gas pedal versus the brake pedal. And so your nervous system coordinates, controls everything within the body. And so when mom is pregnant, we want to make sure that they're living more on that brake pedal side of the nervous system, that parasympathetic side, because the parasympathetic side is where growth, healing, development, all of those good, great things happen because mom is literally growing a human inside of her, and we want to make sure that she is developing the baby properly. So through the adjustments, it allows the nervous system to balance properly, allows mom to have more ease in general, it allows baby to be more at ease. So like in the beginning, I had said some of the benefits that I've seen with the pregnant moms in my practice, but there are so many testimonials out there about all of these wonderful moms going to chiropractors, getting chiropractic care, and having awesome benefits. So that's really the whole gist of this little pop-up webinar and why chiropractic and pregnancy go together like peanut butter and jelly. So if you have any questions at all, feel free to contact me. Otherwise, have a great rest of your day. Bye, everybody.